Welcome to your guide on how to administer your medication REKOVELLE using the REKOVELLE pre-filled pen. REKOVELLE is a fertility treatment that has been prescribed by your doctor. Always take REKOVELLE exactly as directed by your healthcare provider. The pen comes in 3 different dose volume sizes, and your doctor may have prescribed to you 1 or more of these pens. Before you start, you should ensure that you have carefully read the instructions for use booklet, which can be found packaged with the REKOVELLE pre-filled pen. This video will guide you through each step of the injection process. You may pause the video at any time. If you have any questions about your treatment or medication, you should contact your healthcare provider. These are the parts of the REKOVELLE pre-filled pen. You can pause the video here and familiarize yourself with the components of the REKOVELLE pen. The outer needle cap, the inner needle cap, the needle, the protective foil, the pen cap, the cartridge with medication, the cartridge holder, the dose indicator, the dose scale, the dose display window, the dose knob, and the injection button. Before you start, make sure that you have gathered all the items you will need and that you have prepared a clean surface, such as a table or worktop. Before using the REKOVELLE pre-filled pen, wash your hands with soap and water and dry them with a clean towel. Have a needle disposal container at hand. Pull off the pen cap and check the medication in the cartridge to ensure that it is clear and does not contain particles. If the medication is not perfectly clear, contact your healthcare provider. Do not use the pen. Check the expiration date on the pen. Peel the protective foil from a new needle and click the needle onto the pen. Remove the outer and inner needle caps from the needle and keep the outer cap for later. It is important to prime the REKOVELLE pre-filled pen before using the pen for the first time to remove any air bubbles that may be inside the cartridge. Only prime your pen the first time you use it. To do this, turn the dose knob clockwise until the droplet symbol lines up with the dose indicator. Then point the needle upwards and tap the cartridge holder to make any trapped air bubbles rise to the top. With the needle still pointing upwards, press the injection button until the number 0 lines up with the dose indicator. A droplet of liquid should appear at the needle tip. If no droplet appears, repeat the priming steps up to 5 times. If still no droplet appears, attach a new needle and repeat the priming. Your REKOVELLE pre-filled pen is now ready to use. Your doctor or nurse will tell you your individualized daily dose of REKOVELLE. Make sure the dose window shows 0 and then turn the dose knob clockwise until your prescribed dose lines up with the dose indicator. Each number represents 1 microgram and each thinner line in between 2 numbers represents 0.33 micrograms. For example, this is 2 micrograms, 2.33 micrograms, 2.66 micrograms, 3 micrograms, and so on. The dose can be corrected either up or down without loss of medication by turning the dose knob in either direction. You are now ready to give your injection. REKOVELLE is intended to be given by injection just under the skin subcutaneously, in the abdomen, as instructed by your healthcare provider. It is important to alternate the exact site of injection from day to day to lower the risk of skin reactions. Clean the injection site by wiping a small area of your abdomen with an alcohol swab and let the area air dry. Do not touch this area again before you give your injection. To inject, gently pinch the skin around the disinfected area between your thumb and index finger and insert the needle all the way in, straight into the pinched up skin, with the dose window visible. Then place your thumb on the injection button and press it all the way in and hold. When you see the number 0 lined up with the dose indicator, count 5 seconds before slowly pulling the needle straight out of the skin. If blood appears at the injection site, press a cotton ball lightly on the site. You have now successfully completed your REKOVELLE injection. After each injection, carefully reattach the outer protective needle cap onto the needle and unscrew the needle counterclockwise. Discard the needle according to your local waste regulations, as provided by your healthcare provider. Please remember that the needle should not be disposed of in household waste. Put the pen cap back on. Do not store the pen with the needle attached. You should always keep the pen cap on the pen when it is not in use. After its first use, the REKOVELLE pre-filled pen should be stored between 2 and 25 degrees Celsius. For further information on storage, please refer to the Instructions for Use booklet. Discard your pen according to your local waste regulations, as provided by your healthcare provider. Note that some liquid will always remain in the pen. This is normal. If you are not able to set the full prescribed dose on your pen, this means there is not enough REKOVELLE left in the pen to give the full dose. You will need in this case to give a split dose injection, meaning you will need to give part of your prescribed dose using your current pen for a first injection, and the remainder of the dose using a new pen for a second injection. Alternatively, you may dispose of your current pen and use a new pen to give your full prescribed dose in one injection. Here is an example of how to give a split dose. If your full prescribed dose is 8.66 micrograms and you can only dial to 2.66 micrograms, you will need to give the remainder of the dose using a new pen. Before you inject, note down the dose where the pen stopped. You can then give your first injection of 2.66 micrograms. Then take a new pen, insert a new needle, and prime the pen as explained before. You can easily calculate the remainder of your dose by subtracting the dose that you have already injected from the full prescribed dose. In this example, your remaining dose is 6 micrograms. You will then dial the remaining dose, 6 micrograms, and give your second injection. Please remember to use a different injection site each time you inject your medication. The REKOVELLE pre-filled pen dials up to a maximum of 20 micrograms per injection. If your full prescribed dose is greater than 20 micrograms, you will need to split your dose into 2 injections. Follow the steps previously described if you are using a new pen. If you are using the same pen, you will simply give 20 micrograms for your first injection, put a new needle on your pen, calculate your remaining dose, and set your pen with that dose. Select a new site of injection and give your second injection. Should you require further information on how to do a split dose calculation, please consult your Instructions for Use booklet. That's it! You may wish to repeat this video during the course of your treatment. Please remember to keep the Instructions for Use booklet, and should you have any further questions related to the REKOVELLE pre-filled pen or how to inject your medication, please contact your healthcare provider.